Welcome back. Your circulation may not be something you think of each day, but it's certainly important to pay attention to your body. Dr. Allison Burkett is a vascular surgeon. She's here to talk about it more with us. And I tell you what, Allison, this is something that you don't think of every day, but you kind of, I guess, take it for granted in a lot of ways. Thanks for being here.
No problem. Good morning.
Awesome. Well, let's talk a little bit about it. A vascular surgeon, that sounds kind of fancy and everything, but what do you do on a normal basis?
Well, you know, my concern is everything to do with arteries and veins throughout the body, except for the heart and in the brain. Anywhere there's a problem with your circulation, we handle it for you.
Awesome. So if I needed to see you, what are some of the things that I guess you see most patients with, and some of the things you treat?
Most of my patients come in with complaints of pain when walking, and that can either be due to muscle problems, but most times it's due to circulation, poor blood flow to the legs, or poor blood flow leaving the legs, depending on whether it's an arterial problem or a vein problem.
Gotcha.
So I help them figure that out.
Okay, very cool. So it starts at your heart, I guess, and it's pumping through your body, and you have tons and tons of veins everywhere. I guess when you have circulation problems, it's mostly in your legs and your extremities, I guess, because it's farthest from your heart.
Yeah, most common complaints are from the leg pain because we ambulate, we walk a lot, and that's where our symptoms derive from. Most disease also forms there, plaque forms there in our extremities, and from cholesterol, issues with smoking, and diabetic foot problems all culminate from circulation problems to the legs. So that's the those are the most common areas.
Okay, that makes a lot of sense. And I guess for most people, they probably wouldn't worry about it too much, but if you did start to see some things, you might go to your doctor. What are some of the things that you might see, some of the symptoms you might have if you think maybe you have a circulation problem?
I want to encourage patients to seek medical help if they have, like I said, pain when walking that does get better with rest, or nighttime cramping. They both can signify different problems that can be can compromise their extremities and cause limb loss. Also, wounds that just take a very long time to heal. You know, if you hit your toe and it just hasn't healed in a week or two, you should be concerned. So those are the common issues: pain when walking and nighttime cramping.
Gotcha. And what about like if your legs start to swell a little bit, like your ankles after walking for a while? Is that one of the
Great.
symptoms?
I'm glad you brought that up. Leg swelling. You know, some people think, oh, it's just my heart, or a sign of aging, or just from a long day. It can represent a problem with your veins that we can treat easily.
Gotcha.
In office procedure.
And this may not be something, this would be something that you would know about mostly as a specialist, but what if your first medical doctor, your primary care, doesn't catch it? Would that be something that you'd be worried about? Or?
Yeah, we are concerned. I mean, a lot of people are especially diabetics, are sent away, oh, that's from your diabetes, or leg swelling, that's just, you know, elevate your legs. So I want to encourage patients to be their own advocates and, you know, say, do you think I should see someone for this, maybe a vascular surgeon?
Absolutely. Well, Allison, thank you so much for being here today. Learned a lot of good stuff about circulation, and we'll have all that posted on 41nbc.com if you want more information about circulation, and a good way to get in touch with Allison as well. Thank you for being here.
Thank you.
Awesome. Appreciate it.
Thank you.